on this episode of Shak, we're taking a look at mental health and therapy. More and more each day, we see the effects of mental illness and the importance of prioritizing mental health. But a lot of the discourse still surrounds self-care and self-help remedies, but sometimes people really may need more than that.
Mm-hmm.
I think we're all aware of the stigma surrounding mental health challenges, and in particular, the need to consult a professional. Nonetheless, I do see some strides where I do see persons bravely giving voice to some of their own personal struggles, but certainly in Barbados and the region, it still feels a bit taboo. So today we have the pleasure of chatting with Joana Matthews, who is a qualified counselor who operates Counselling Solutions, a private practice serving clients aged 16 and over. So welcome, Joana, and let's talk therapy.
Hi, thanks for having me.
Yes. So people sometimes view mental health treatment as a luxury of the rich or perhaps the unfortunate fate of the troubled. This kind of aligns with some of the, the roadblocks to therapy, maybe stigma or cost. So maybe we could talk a bit about that. Maybe you could share your general thoughts on some of the things that discourage people.
I think more than anything within our Caribbean culture, what is discouraging is that it's not widely advertised as something that is beneficial to your health in general. Mental health is health, right? That's the takeaway of this evening. And if we were putting it out there like we put out diabetes and, all the other problems, obesity, cancer, if we were putting it out there like we did those things within our culture, I think more people would be accessing it. And it would also help to get rid of the stigma as well. But the fact of the matter is, anybody can go to counseling and anybody goes to counseling for a variety of reasons, as varied as their personalities.
Okay. So that leads me to, I guess, one of my other questions. What are some of the things that lead people to therapy? All right. Is it, just the extreme cases like death of a loved one or something like that? Or do people end up in your office more like casually, so to speak?
That's a very good question. You have people of a certain level of understanding of self who are just looking to grow as individuals, so for personal development, and they will seek out therapy as they would seek out a medical consult. Like you go for your yearly physical. People will come because they just want to have sort of like an evidence-based feedback, so to speak, on their journey. So there's that, and that's healthy, and that is highly recommended. And then, of course, you have people seeking therapy for all sorts of life issues that might include circumstances of bereavement or death, separation, whether it's separation through divorce or separation through moving locations, that kind of thing. Other major life transitions, such as if they've had past experiences that they need to process, such as in childhood. And then there are people who come specifically to deal with specific psychological concerns to them. So racing thoughts or compulsive thoughts or persistent thoughts, things that are just there and not going away. Some people come because they're having difficulties relating to others, whether in their home environment or their work environment or their school environment. And some people come to cope with feelings of depression, anxiety, stress. But yes, a lot of people come for personal development as a preventive measure. So people, and that too has to do with a little bit of awareness now. I should say that more, the people who come more for personal development are usually people who are within the corporate environment and within the younger generation, at least in my practice.
Okay.
they're coming as a preventive measure. They're going into a new job and they want to make sure that they have communication skills. So, to have an advantage, or there are people who are getting married and so they want to do premarital counseling to make sure that they enter their marriage with the appropriate tools. So that kind of personal development.
Okay. Well, as you said, it's varied as people's personality. So, in terms of what persons can expect on like their first visit, imagine somebody who, has never done it before. What can they expect? I know there may be some myths that you want to debunk here. You may be laying on a couch, but
Yeah.
what can they expect?
Well, the lying on the couch thing is very specific to the psychoanalytic Freudian counseling perspective. And even these days, it's not so much done. I mean, some therapists will have couches and you're invited to sit wherever you want. And if you want to lie down, so be it. But it's not necessarily what happens in real life. It's a past method, so to speak. What would usually happen is you would come into the session, you would greet the counselor and vice versa. And what would follow would be what we call a clinical intake or a clinical interview. And this is where we're asking all sorts of questions because we're trying to gather your history. And your history would include things like, medical history, your interpersonal history, like how you've been, dealing with people, family history, mental history. Is there a psychological concern in your family? And then, of course, we move on to what brings you to therapy. Why are you there to, for the day? In between there's some very important things that have to happen. The counselor must speak to you about confidentiality. It is the hallmark of the introductory to counseling sessions, the introduction to counseling sessions, at least in the first session. And the conversation is usually basically telling you that everything you say is confidential, and then the counselor will expose you to the limitations of that, and if they have to break confidentiality for any reason, how they would probably go about it. And then you move into your presenting concerns, and it's really just talk therapy. It's not, everybody who goes to counseling has to understand that it's a process. It's not a medical examination, so nobody's going to be looking at your body and saying, well, go home with this medicine, because, right, it's not that kind of, it's not a one size fits all. Your problems won't fit into a box. There are problems that are similar, and research has been done on the problem itself first to understand as much about the problem as possible. But the reason why you come for individual work and you don't just take everything off the internet or off somebody who's unqualified and think that they know what they're talking about when we talk about anxiety is because your personality plays a big factor. Your personal circumstances play a big factor. And the counselor has to use their analytical skills to be able to listen to what you're saying empathetically, and then provide you with some sort of interpretation and get you to a place where you are solving the problem.
Okay.
So yeah, that's what you can expect. It's talk therapy.
Fair enough. It makes sense to me. So, I mean, in terms of, we talked about what they can expect on the first visit, maybe some of the things, and maybe you touched on it there already, but some of the things that you do to put your client at ease. You did mention confidentiality, but somebody's a bit nervous, some of the things that you have found kind of put them at ease, because obviously it's a high stress situation most times.
Yes. So absolutely, there must be rapport building as soon as possible, usually within the first session. And we do this by, again, listening with as much empathy as we can, being our authentic selves. And what that means is we're not trying to say that we agree with everything that you're saying, but we will validate. So, you know what I mean? Like, I can understand your perspective. It doesn't necessarily mean that I agree with everything that you're saying. So we're authentic in that regard. We give or we provide unconditional positive regard, meaning that we're open, we're welcoming, we're open-minded about whatever it is you're willing to share.
Yep.
Sometimes there's resistance. So usually we find resistance in people who are oppositional or demonstrating avoidance behaviors for whatever reason. It might be a defense mechanism for them, or it might just be that they're not on the same wavelength as the therapist at that point in time. Like they've been mandated to go to therapy. And so, you know, the counselor or the therapist is talking about, well, let's work on some problem solving so that you don't do that again and you don't end up before the judge again. And they're not there. They just want to go back to whatever bad habit. You understand? So that brings resistance. And usually, in addition to the things that I just mentioned, you know, the unconditional positive regard, the listening with empathy, the validating, and so on, we would use a lot of open-ended questions, so to elicit more conversation and hope that will, you know, get
that
the
would
client
open the
Yes, yeah. I use a technique in counseling called self-disclosure, and I will usually find an opportunity for self-disclosure within the first session, because I find, for me, in my practice and within this culture, that helps to put somebody at ease, to see me as vulnerable, to see that I have something in common with them, or even if it's not in common, it's a story that makes a point to whatever it is they're bringing to me. So that usually helps to bring rapport.
Yeah, and you mentioned rapport between the client and the therapist. Would you say that's one of the most important factors in developing this relationship, having rapport?
Absolutely. If there is no trust, the process is flawed.
Yeah, I agree. And you really have to trust trust the person that you're disclosing this very intimate information with.
Because sometimes the therapist might have to use a technique that might be considered controversial in and of itself. So for example, one such technique would be something we call confrontation. This is where we make statements to you, or we question you in such a way that points out a discrepancy between what you're saying and what you're doing, or what you're saying and what you just said that you're thinking. So we point out discrepancies to you. And as we know, in our everyday life, we don't, as people, normally like people to point out when we're wrong, right?
Definitely not.
Right. So you really have to trust the counselor, and you really have to trust the process, and you have to see, you know, where you're coming from and where you're heading. Another reason why we actually use, in my practice, I use collaborative goal setting. So I don't just decide that I'm the expert on you and I say, okay, we're going to work on goal A, goal B, goal C, right? I come up with things based on what you have shared with me in your first couple of sessions, and then I present to you a plan, and you have the opportunity to say, well, I agree with this, I don't agree with this, let's add this, let's remove this, because I feel like as if I've worked on that, and so on and so forth. So all of this helps in building the trust and building the rapport.
Yeah. So you did mention some of the techniques that you use in, overcoming some of the challenges that your clients may face. So maybe you can just give me maybe a high level of some of the main methods or the main approaches that you might take to, of course, that depends on what the particular issue is. But if you have a kind of overview of some of these methods.
So there are so many theoretical orientations that we use as psychologists and counselors, and quite a majority of us use an eclectic approach. In my practice especially, I use something called cognitive behavioral therapy, which is a process that takes you to understand how your thoughts affect your behavior, and then affect your emotions, and that cycle and what it means, and there are interventions in between there. And then I use solution-focused therapy, which approaches your situation from a solutions focus rather than a problem focus. So we're not focusing on the problem, we're trying to figure out what do we do about it. So having said that, some very specific techniques from within those theoretical orientations that I like to use are things like, I will do a lot of cognitive restructuring assignments where I invite the clients to challenge their negative thinking patterns. Of course, we have to identify what those negative thinking patterns are, and we speak about how to challenge them. They will probably get homework in the form of journals and so on. And my preference is that they go into the real environment and they practice these things for about a week or two before they come back for a follow-up session. I will use things like behavioral experiments. So for example, if a couple was to come to me and they indicated that they had problems with intimacy, I would probably give them an assignment to go and come up with 6 dates each and come up with a schedule as to how they're going to make sure that they have those dates with the aim of building intimacy. So that's a behavioral experiment. I would do things like relaxation strategies that would benefit persons with depression, anxiety, stress, a whole host of other issues. And there are all sorts of different things that, so deep breathing, mindfulness, progressive muscle relaxation, all of those fall within relaxation strategies.
Okay.
Yeah, so those are just a few.
Okay. Well, that, I mean, that, as I said, it would definitely depend on the particular client.
Yeah.
But certainly, it does seem like fairly comprehensive.
Yeah.
One thing I was curious about is in terms of, do you find there are equal numbers of women and men attending your therapy sessions? And do you find there are any differences maybe in their outlook or their experience of that therapy?
That's an interesting question. I was actually looking at my own practice recently. I can only answer in terms of my practice. I don't know what research has been done here.
Yeah.
I have currently more women attending, but since I started private practice full-time in 2014, I started part-time in 2012, but since I started full-time in 2014, the number of men who have been coming have increased steadily every single year.
Okay.
And in terms of the kinds of issues that they come for, very similar, very much on par with what the women come for. So anxiety, depression, stress, issues in their relationship, issues with their coworkers, issues with their boss. So the reasons why they come are on par. Sometimes though, their perspective and their approach to things are slightly different. But they are just as committed to the process and very much willing to do the work. I find my clients, both male and female, who come are serious about it. I mean, we're in the Caribbean, we don't waste money.
True. that is a good point. I concur.
So when we come to therapy, we come to do the work. We're not playing games, right? So I'm very happy that has been my experience, because there's a technique in psychology in counseling called silence, and I'm not a fan of it. I would prefer not to use it. Sometimes I use it when it's absolutely called for, but not for very long periods. So I like when my clients come, they're ready to work.
Okay, so so you said that technique is called silencing, is it?
Yes, sitting in silence. So,
okay.
You probably share a technique, or the person probably has sort of an aha moment, and, you just remain silent and allow that person to have a moment and go through their own thoughts, because it's talk therapy and it's a lot of back and forth. Yeah.
Okay.
Yeah.
So, interesting. In terms of, one of the other things I was considering is whether therapy is viewed as a short-term solution, or is it like a lifestyle where you're going to the gym or you're going to get an annual checkup with your doctor? What's your kind of view of, therapy?
That's a very interesting question. I think for me, the more objective answer would be to say it's both, depending on the person and the situation. For some people, it could be a short-term solution where they come and they equip themselves with tools, and so when the concern or the problem pops up again, they are able to handle it. And for others, it's sort of a lifestyle where you go for a period and you're fine for a period and you may have a relapse, or you may just want to check in and make sure that everything is still okay. So you go like once or twice a year. So, there's that. And then there are other people where it's a lifestyle in the sense that they come every month, at least once a month, just to check in regardless. So it all depends on the individual and the concern that they have.
Okay. So I guess my last question would be, if there was just one thing you wanted people to know about mental health or maybe therapy, what would that be?
Just one thing.
Well, I mean, if you have two, it's okay. That's fine, Okay, I'll take two. No pressure.
I would say the first one is your mental health is health. Just the same way you take care of your physical health, you need to take care of your mental health. So that's the first thing that I would say. The second thing I would say is, in order for you to be mentally strong, in my opinion, and based on what I've seen in my practice, it's not enough to just look up good things that you can do. You understand, to grow, like, the relaxation strategies, all of the affirmations, and all of the wonderful things that you will access on the internet and so on. It's not enough to just input good things. You have to work on removing the bad habits as well. And only when you find that balance are you, mentally strong. So, two things. There you go.
I mean, if there's one more that you feel compelled to share, I certainly wouldn't stop you.
Okay, I would say that the third thing is that the same way we could go to our pastors for spiritual and counsel and enlightenment, and the same way we could go to our medical doctors, and in some cases people in the Caribbean will still go to the voodoo man to understand what is happening with
That's
them.
True.
If you're gonna try all of those things, and some of them are good things, why not try counseling, right?
Yeah.
So yes, that's what I would say third.
I feel that is a compelling point. I agree with that.
Remove the stigma, stop your nonsense, and go and talk to somebody. Get some feedback from somebody who's not your friend or family member.
I agree. I feel that there is definitely value in that.
Mm-hmm.
So thank you so much for joining us today, Joanna. It was indeed insightful. Hopefully this session is useful to listeners and inspires some new conversations on mental health. And, for people to consider some, as you said, to consider their mental health and some of the things that are available to them if only they would give it a try.
Yes.
Okay,
thank you so much for having me. I had fun with this conversation.
As did I.
All right, bye.
Bye. Thanks for listening. Don't forget to join us every other Wednesday for another episode of Shak. Subscribe to our podcast using your favorite podcast platform. We are on Apple Podcasts, Google Podcasts, and many more. You can also connect with us on IG, Facebook, and Twitter, or by email at akilia@shakshak.club. Let's shake things up.